The pandemic is over. We know that. The president said so in July, although then he argued in court that you should still have to wear a mask on planes and trains. But then in court, his administration argued that the pandemic was over so he could lift Title 42 at the border. But then just yesterday, the press secretary, Karine Jean-Pierre, said the pandemic isn't over. It's very confusing. You can understand why. So we've got school systems around the country now thinking about bringing mask mandates in for children, which never really made sense. And it seems like the LA County health people are constantly wanting to bring mask mandates back in. What's really going on here? And even if we don't have new mask mandates, is it really enough to just say, live and let live, the past is in the past, let's move on? Or should we actually look backwards and say, why did we have to have these mask mandates in the first place since the science didn't support it? Ooh, speaking of science, great article over here at Real Clear Policy. The headline, That's Science? Congress must probe the rationale for COVID mask mandates. It's written by a pretty smart guy over at Heritage Foundation, Bob Moffit, Senior Research Fellow for Health Policy. And in fact, he joins us now. Bob, thanks for joining us.
Great to be with you, Larry.
Let's, instead of looking backward, and I do want to look backwards because I want people to pay, but right now we've got jurisdictions, we've got elected officials implementing this on our kids. Is there anything to justify mask mandates right now?
I don't think so. I think they've got to make the case. And one of the points of the article that I wrote had to do with the government's position on mask mandates. If you will recall, in February of 2020, at the very beginning of the pandemic, the entire top tier of the public health establishment said that masks were ineffective in controlling viruses. They were ineffective in preventing transmission or infection. And that was the position of Dr. Anthony Fauci. That was the position of Dr. Nancy Messonnier at the CDC. It was the position of the Surgeon General of the United States, Jerome Adams, who went to social media and said, seriously, people, don't buy masks. They're ineffective.
Right.
However, in April of 2020, in that very brief period of time, there was a 180-degree reversal on the policy with regard to masks. And all Americans were asked to wear masks.
Yeah.
And even masks for school children. It was a very strange and mysterious change.
I do remember this. And by the way, I remember, Fauci came back and said, well, I just said that because I didn't want there to be a run on masks because people in the front lines knew that. So basically, afterwards. So here you got Fauci basically saying, well, sure, I lied, but it was for a good cause, which I think is noteworthy. But secondly, I do remember, listen, personally, I thought it's like, hold on a minute. If you've got doctors and nurses constantly wearing masks and protective gears to protect themselves from COVID, but we're being told not to. We're being told not to get masks because then people at medical facilities won't be able to wear masks. If it's protecting them, why shouldn't we wear? So I was sort of skeptical at the time. I was like, maybe these masks are a good idea. But was there ever science, Bob Moffit, to justify the mandates for masks specific to COVID-19 and that virus?
Well, look, there had been literature dealing with masks, even going back to the 1918 flu, which was a horror show.
Yeah.
But the literature basically, it's hard to summarize, but I'll just simply say this.
Sure.
There's some very good evidence that masks are very useful if somebody has an infection, that it will prevent other people from getting an infection.
Yeah.
That's why doctors and nurses wear masks in surgery, for example. They, if you're cutting somebody open and you're taking out their gallbladder and you have something that you may not even know of, you don't certainly want to give them, a bacterial infection or a viral infection.
This makes sense. If I'm at a Chipotle and the guy next to me is coughing and hacking, a mask is it's gonna help a little bit. It might not prevent me from.
Look, we're talking common sense here.
Yeah.
Right. If you're in a very crowded area, and like you're on an airplane, for example, and you're surrounded by a lot of people, and then people are coughing and so on, it might make sense. The other thing to remember about this, and it's a point that Dr. Makary of Johns Hopkins raised, Not all masks are the same. The cloth masks are generally ineffective. That's what the literature shows.
Right.
N95 masks are stronger, and they do make sense, especially if you're in a crowded area. That's what Dr. Fauci initially conveyed to a former colleague of his, a former Secretary of Health and Human Services, Sylvia Burwell, in an email when she asked the question, should I wear a mask at the airport? He basically said, no, they're not effective.
Right.
That's what he said. And that was a private communication to a former colleague who was concerned about her health.
So,
For crying out loud,
yeah.
if we're going to have, major public policy that is going to be imposed on a country of 333 million people, we have to have some very sound foundation for that. I'm not saying that all masks are ineffective and
Totally
frankly,
understand.
say that. The point is that when federal officials make very specific changes, we need to know the rationale for that change.
Right.
And in the case of masking, there was a 180-degree reversal of the position of the public health establishment between February and April of 2020.
Right.
Congress should find out why.
Yeah, let's get to that point, because then I think it was April or May, the CDC comes out with guidance, with a recommendation, and suddenly that guidance gets seized upon by state governments, state health officials, county health officials, and the guidance from the CDC then turns into mandates.
Correct.
And I want to be clear here, Mr. Moffit, because you're right. We need to look back, find out how exactly that happened, what the science was behind it, because we need to have trust in our public health officials. If a public health official says you have to do this for your own health and safety, we've got to have confidence in that. Otherwise, we're going to ignore them the next time they tell us something, right?
You're right. And that is one of the biggest casualties of this entire, 3-year horror show, is that we have had a loss of public trust in an area where we can't lose it, which is in public health. We've got to restore that. Congress can help restore that. And they're not going to do it, with a kind of a gotcha, set of inflammatory congressional hearings. What they've got to do is they've got to drill down calmly, effectively, to pull out the absolute truth, the indisputable facts surrounding decisions that were made at the CDC, at the National Institutes of Health, and in the White House. Nobody is free from this. They've got to do it. They've got to be calm. People are understandably angry. But now's the time. Now's the time to put the anger aside and focus on getting at the truth. Because if we don't, the next pandemic, we will suffer even more.
I'd actually like a few gotcha moments during the hearings, but I'll defer to you, Mr. Moffit. We only have a minute left.
They're fun, no question about it.
We only have a minute left. Other countries had even more robust mask protocols than we did because they don't have that pesky constitution like we have. Is there any science from other countries that the masking protocols actually reduced the spread of COVID-19?
Well, there were studies of, for example, masking of children. There was a big study in Spain, and they found out that the masking of children was ineffective. But the idea of masking children, actually, the United States became an outlier among the international community in that area. So, we do have a lot to learn from what other countries did. Sweden, for example, had virtually no lockdowns. They didn't, their death rate was not a horror show. We and the British roughly had the same mortality. And Britain was actually more authoritarian than we were in certain areas. There's a lot to learn from the international experience. By the way, if you want to talk about the effectiveness of lockdowns, you see China, don't you?
Right, yeah, exactly. And they have the opposite of the Constitution. They have totalitarianism. We got to leave it there. Bob Moffit, Heritage Foundation, thank you. And why were we the outlier in masking children? We have another thing that other countries don't have, a teachers union. More to come on O'Connor Tonight.